Good afternoon. On behalf of the Greater Baltimore Committee, welcome to Baltimore. I'm privileged to serve as the chair of the GBC, and as many before me have focused this audience on, this is an amazing time to be in Baltimore. I want to, for a minute or two, create a list with you. I want to start a list, and I'm going to put differential assets on that list. And I'm going to put on the list differential assets in higher education that you've heard about, differential assets that you've heard about when it comes to my world of healthcare, differential assets when it comes to financial services, differential assets when it comes to technology and life science and innovation, differential assets when it comes to the physical assets that define whether it's the Inner Harbor or the Port of Baltimore, what you saw at Trade Point Atlantic, differential physical assets that are on this list. And now I have a question for you. Who wants to trade? Who would want to have these assets to build the future of their region? And that is the foundational question that we as leaders in Baltimore are trying to bring forward to audiences such as yourself, because we believe we have these differential assets, and we also believe that now is our time, and you've heard that. The University of Maryland Medical System, which I am blessed to serve as the leader of at this point in our history, we are a health system, a private, not-for-profit health system with a symbiotic relationship with the public University of Maryland system. We are one of the state's largest private employers with 30,000 team members around the state of Maryland, and we love to say that our impact is across the state, but our heritage is uniquely Baltimore. And we say that by waking up every day and thinking about Marylanders, we influence the lives of not just the citizens of this community, the communities that we're blessed to serve, but the citizens around the state, around the nation, and indeed the world. And we are not alone in that. The University of Maryland Medical System, we are proud of our heritage, but we're even more excited about our future because we understand the investments that are needed to drive the mission that we exist to serve. In academic medicine, we say that we exist to improve the human condition. And the good news in this region is we are not alone. You've heard from some of our other colleagues, and we lean in together. One of the foundational cultural aspects of our community is that we lean into challenge together. And so when we think about another asset within the medical system's lens, and within the lens of healthcare, we think about the assets of data. Data is undoubtedly in healthcare a critical asset that can shape the future of how we think about keeping communities healthy and how we think about addressing some of the greatest healthcare challenges that our nation and our collective community around the world face. And it is the use of data that we have been very purposeful in investing in. The Institute of Healthcare Computing at the University of Maryland, is a partnership between the medical system and the public university to create a learning healthcare system and create an ecosystem that brings in private investment to create future evolutions in healthcare. And that is just a simple example. And when I want to also mention, before I step aside, I want to point out again something that culturally defines our collective community. We go together. And if you don't believe me, one needs only think about how this region decided to handle the challenges associated with the once-in-a-multi-generational pandemic. It was not just leadership from the city. It was not just leadership from the state, leadership from the feds, leadership from Hopkins, leadership from Maryland, leadership from MedStar. It was the collective that led to our approach to handling the unexpected challenges of the pandemic. But make no mistake, it was also innovation. It was also where the creation of vaccines that helped put us on a different path, impacted not just our community, but indeed the world. It is our use of data that helped inform us. And that is the roadmap that we collectively think about, not just at the University of Maryland Medical System, but with our partnership with institutions such as Hopkins and MedStar, with the city of Baltimore, with the state of Maryland. Now is indeed our time, and we will leverage these partnerships going forward. Thank you for being here in Baltimore, and enjoy the rest of the day.